Yo, what is going on, you guys? It is almost 7:30 in the morning, and why do I have this big, bright, twinkled eye smile so early in the morning? It's because today I'm going to be observing a total knee replacement surgery. Today is actually going to be super dope because I get to see the full and experience the full continuum of care. So basically, I'm going to see a patient today, pre-operation. I'm going to talk to them. The surgeon is going to talk to them, and I'm going to be with them throughout everything. So pre-op, the whole surgery, and then even after post-op, day 0 and day 0 after you have a replacement. For those of you who don't know, total knees and total hips, you can pretty much have physical therapy and start walking as soon as on the same day of your surgery. And that's what I've been doing, as you guys know. So it's gonna be cool because I'll see them pre-op, the surgery, and then right after, I'm gonna be personally treating them and talking to them like, dude, like this is what happened in your knee and your surgery and all of that stuff, and then get them to walk and then hopefully send them right on home. Super excited about that. Like, I've been really waiting all my internship, and then finally they said, all right, you can go see a surgery today. So I'm stoked. I'll keep you guys posted on the surgery and give you guys the updates, the inside scoop. It's like 31 Baskin Robbins here because it's like you guys are getting the inside scoop. Yeah, that was pretty dumb. Okay guys, I just finished in the OR seeing the whole total knee replacement, and I had to go into this equipment storage room to just take this time to vlog because it's getting crazy before I forget everything. It was so cool to witness that thing, and oh my goodness, the surgeon was amazing. It was crazy. So first off, you go in, I thought I had to be sterile, but there's actually, you can be in the room, but obviously right next to the patient and all the things that the patient is touching, you have to be sterilized. So you gotta wash your hands and go into this environment where everything is super sterile, right? And then so after that, as they're going, you know, it's like, it's crazy how much experience. Wait, there's like a alarm. They said code red. Hold on. Alright, code red. Not sure what that means, but I'm still gonna vlog because this is really cool. Hold up. Actually, I probably should. Code red in the kitchen in the basement. Ah, something burned. Anyway, so it was so cool. So basically these guys have been obviously doing this for a long time, and they make it look so easy. The doctor, the surgeon is like working on the knee and like talking to people and like paying attention. He's talking to me. It's like, hey Justin, go over there, watch this. Hey Justin, this is the meniscus, this is what it looks like. Hey Justin, this is the back side of the patella, the distal part of the femur, the proximal part of the tibia. This is where it articulates. And look, if you put this thing in, that's like a stopper. It's made of this material. This is how you cement it. And all this stuff is like, wow. It was also cool because the surgeon was explaining everything to me, the process of what he was doing, how he was cutting it. Like, he was saying like, this is what I use, so I make sure that it's a clean cut. It helps stabilize the incision or the saw that's going through the bone. And like, it was, I mean, this knee was like, boom, it's like right open in my face. And then they're like sawing the bone, the distal part of the femur, the proximal part of the tibia, the posterior part of the patella. I mean, those of you who are physical therapy students, the fat pad behind the patella, like he was like, look, oh, here's the fat pad. Take it out, and then he put it in the little bucket. And I was asking the surgeon, I said, well, if you remove the fat pad and that has a lot of nerve endings to it, and that can be a really big source of pain, if you took it out, can they still have pain in that area? And he said, no, probably not, because it's gone. What? He also had to cut through the ACL and the PCL, and so stability wise for anterior and posterior, there's actually, the way that they do it is there's this like post, and it kind of like clicks or locks into this place. So you have a full knee extension in 0, and then you get to about like 130 in full flexion, and that's all you get. And then when you try to do an anterior posterior drawer, it'll just like clunk on something like a hard end feel, because there's like these stoppers that are going to hold it. So no more ACL, no more PCL, but they still have their MCL and LCL still intact. And so he was telling me like he put the knee in full extension and bent it a little bit, and he was putting a valgus and a varus stress on the knee, saying, hey, look, like you still want a little bit of joint play, you still want a little bit of laxity, because that's what the knee does. You want to see it in flexion, and he did the valgus and varus stress again, showing like, yeah, like we need that play a little bit, and because if it's super taut, then that's going to be a big source of pain all the time, right? And it was, I mean, this surgery, it was just super cool. And as a physical therapist, or a future physical therapist, you know, all we see is they come to us and we just see literally the incision, and that's it. And maybe we mobilize a scar, and that's all we know. So the fact that I was able to witness the whole operation, to see how they put in the parts, how they put the cuts, it really puts into perspective of the source of pain, why they have pain in certain movements. And then when you go through an exam and then you evaluate certain impairments, you'll understand like, oh, okay, like you have that impairment because this is what happened in the surgery, and so now I have a better understanding of how to treat you a little bit better. It was, I mean, I'm freaking in the closet and I'm vlogging during my work hours, and my CIs, if you're watching this, I'm sorry, but I just had to. It was just way too exciting, and I couldn't let this go, and I had to take this moment to just record this very special moment. And I'm so thankful for Kaiser. I'm so thankful for this opportunity to be able to witness something like this, because I don't know, I'm just on a high right now. Like I only got like 5 hours of sleep last night. I'm just like, oh, like this total knee was like everything and more that I imagined. And those of you who are watching this vlog right now, if you're trying to get into physical therapy school or anything related in fitness, muscles, human body, mechanics, all that stuff, and you're gonna have to deal with total replacements of either the shoulder, knee, hip, whatever it is, I highly recommend that you go and experience a OR, a replacement surgery yourself, because it has been eye-opening, especially for me because my eyes are so small. And I am just lost at words, even though this vlog has been more than many minutes long. If you guys liked what I talked about in the surgery, go ahead and give this a thumbs up. If you have any questions about what the surgery was about or anything like that, please put it in the comments and I'd love to answer you guys back. Thank you guys for tuning in. This has been a phenomenal experience. Your boy is back in the equipment storage room because I needed to vlog about this just real quick. Had a patient today, and she went into, we had to call code rapid response on her. She was saying like, oh, I feel fine. Her son is there on bedside. She's a little bit of a bigger lady, so we had to have 2 of us there. And then we sat her up, and then all of a sudden she's like, eyes are kind of rolling back, eyes are down. The son is like, Mom, answer, hey, look at me. She's like, huh? Look at me. Yeah, hey, I'm here. Going back and forth. Luckily, one of the nurses came by, checked the blood pressure. It was like 100/70. It's like, oh, it's a little bit low, but she's just kind of like going and going. So you know what? Let's just put her down. We'll put her back in supine, lay her on her back, take the blood pressure again. 60/40 something. Whoa! Code rapid response initiated all over the intercom. Code rapid response. Code rapid response. Code rapid response. And then everyone is rushing into the room, and I'm just like slowly backing out. But she was okay. She was under the doctor's care, the nurse's care, and all of that. So went back after like an hour, and she was just fine. But man, that was a little bit crazy. I talked to some of my colleagues here, and they're like, "Well, that's good. Just now wait till you have to initiate CPR on somebody." What? CPR? They're like, yeah, you know, they're kind of passing out and check the pulse, no pulse. Gotta start CPR. Thank goodness I didn't have to do any of that today, but man, this morning shift was rough, full, still skin.